Representative Linehan.
Thank you very much, Mr. Chairman. Hi, and welcome to the committee. Thank you very much for your willingness to step up and serve, Doctor. I will preface this by saying I normally don't ask a lot of questions in this committee. However, the Board of Education is actually extremely important to me personally and professionally. In addition, your comments on children's mental health. I'm one of the lead authors of the transformative mental health bill that we passed a few years ago in conjunction with CCMC. I was really proud of that, and I think that it has created a lot of opportunity for change. I know that my colleague thinks we haven't done much, but I will agree with him that there is still so much more to do. So one of the concerns I had with one of your answers was your exact words were that you don't think schools should be mental health providers. However, in your resume, it does say that access and equity to health care was something that you've worked on and is of great importance to you. I feel as though those two things don't actually match up, so I'm going to give you an opportunity. Do you need to expand upon why you think schools should not be mental health providers?
Thank you so much. I appreciate the opportunity to clarify. I think schools are critical in identifying issues of mental health with their students. I do think there is a role for the school counselors in providing that service within school. What I should have said is I don't think they should be the only source of mental health care for those kids. I do think there is a role of collaboration with community mental health providers and with the children's pediatricians in coordinating that care together.
Sure.
So
I understand that. I think one of my concerns is that access.
Right.
And the State Board of Ed did have to get involved when there was lack of access and in one of the districts to mental health care, and the students had to rally in order to get that. It should never be to the point, in my opinion, where the students have to rally for the things that they need for their local Board of Ed to say no, and then have the State Board of Ed overturn that. So you talked about the integration of supportive mental health policies. Mm-hmm. So what do you believe supportive mental health policies would be that would walk that line between being sole access within a school for these kids that maybe don't have access, whether it be because their parents feel that they don't need it, or whether it be because there is a drought in the area, or whether it be because they simply don't know or understand that they need it at this time, and you're seeing the effects of that.
Yeah, no, I think that's a really great question. We wish that mental health access was easy in the state. And I do believe, based on some of the things that came out of that legislative work, as well as some of the work of the regional health systems, that we are embedding mental health providers within pediatric practices across the state. The Connecticut Children's CIN has been instrumental in doing that in the work with the village locally. Unfortunately, I do think there are areas that kids don't have access to that, and that's where I do believe the schools can play a very important role in having those people available within the school system. My perspective is I don't think the schools should have to shoulder that burden by themselves. I do think this should be a huge collaborative effort. And I do think on the local level, the school system should be working with their local health professionals.
And do you believe policy should be enacted in order to support that?
I think policy would be great if it supported that.
Great, thank you. And then I have just one other point to ask about. Unfortunately, over the past few years, we have seen continued sexual abuse of students. Just yesterday, another teacher was arrested for an inappropriate relationship with students. One of the issues that I have taken on personally and professionally is the sexual abuse of children by adults, especially teachers and coaches. And so in the legislature, I have continually put forth legislation in order to not only stop the abuse, recognize the abuse, talk about grooming. I've also looked to strengthen penalties against abusers. But it needs to be this holistic approach. This legislative body has passed numerous pieces of my legislation into law that would help do that. However, I've seen consistently that schools are not actually doing what they're mandated to do. One of them is I try to make it as simple as possible. And I don't want to put words in your mouth, but it seems to me that with what you've been saying, you agree that education is key in these instances. And we put forth legislation that would have teachers, parents, and students receive information on what grooming is, how to recognize it, and what to do when you see it. And that information is supposed to be shared 3 times per year. It has not been shared in most districts at all. What can you do as a member of the State Board of Education or what will you do in order to ensure that mandates like these are not only taken seriously, because I think that they're not taken seriously, but to also ensure that they are actually adhered to?
That's a great question, and as a general policy for the State Board of Education. I will tell you personally, I've worked with several different organizations on those issues. I have one of the families that I took care of for years. The mom is heavily involved in the online version of that and doing work on that. As well as in the practice at Connecticut Children's, we're working with a former detective from Weathersfield who is doing a whole campaign on having active conversations with teenagers about these issues as well. As far as the board is concerned, I think that's the role of the board, is to take policy that's passed and determine how to appropriately set up guidelines, but also to be able to monitor the use and report that back with transparency. So yeah, I agree. I think those are very important for the mental health of our students and to protect those students. So I would bring that forward to my fellow board members as, how do we monitor this? How do we ensure that this is being followed through the way the legislators asked us to?
So if you are appointed, I can count on you to work with me directly in order to ensure that that happens?
Yes.
Great. And one last thing. I think I may be the only legislator in the entire building who does not support a cell phone ban. I think it's actually more important that we instead teach our children how to use them responsibly and to put them down when it's appropriate. Because if you are just keeping them away from kids, then the second they get out of school, they're on that phone the entire time. And they don't know how to control themselves. And so I believe it's best to have policy to teach them how to control themselves instead of an outright ban. That's not a question, that's just a statement. Thank you very much.
Can I say I